Today it's a privilege to talk to you about my friend and long-standing colleague, Trisha Dunning. Those of you who knew her, and those of us who knew her, knew that she, or know that she was an incredibly selfless person who gave her knowledge and support and skills to other professionals and to people with diabetes in order to help people with diabetes have better life living with this condition. She worked tirelessly. There are 1,447 minutes in a day, or 1,440 minutes in a day, and she made the most of every one of them in making sure that people with diabetes got the care that they needed and at a standard that she felt was acceptable. She worked hard to actually make that happen. My role today is to talk about ADEA, and during her time in ADEA, she was secretary from 88 to 89. She was president from 89 to 92. And during this time, in 89, the ADEA became incorporated. In 1990, the classification for diabetes nurse educators became recognised in the career path and in the award, which was an important achievement. And also at this time, or shortly after this, the certification process commenced and was in its infancy around identifying courses and giving rigour around the courses for people with an interest in becoming diabetes educators to actually go on and develop this particular skill. And so there were some significant achievements during her presidency, which are enduring today. I think those of us who knew her would say that she will be sorely missed by the profession and by those of us who knew her as friends. But her legacy will live on. And so, and I know that her research and the research that has been done and is currently in progress, and the legacy of her memory in regard to research will endure her love of research and the contributions that she made in so many ways.
And I'd like to just make a few concluding remarks about the person that Trisha was. She gave me my first position as a diabetes educator in 1993 when she was managing the service at St Vincent's Hospital. And back in those days, she owned and rode horses, would go fencing, and would love the cricket provided the players were wearing white. She was a great cook of Indian food. She always drank tea out of a teapot and would love a strawberry daiquiri or a glass of Billy Cart salmon champagne. She was devoted to her garden and had a passion for natives and companion planting, and always had plants that had medicinal purposes. She had an amazing knowledge about essential oils and complementary therapies, and wrote many papers and guidelines around their evidence and support in clinical practice. She would make beautiful oil combinations for burning or as part of hand creams as gifts for many people. She could live on 4 hours of sleep a night, read an entire novel in one night, particularly if it was about King Arthur. She had absolutely no sense of direction and could not read a map to save herself. Trisha was a wife, mother, grandmother, but also a mother to many fur babies that included alpacas and white Highland Terriers, all with proud Scottish names. She had a love of words and devoted many hours to buying beautiful cards and writing equally beautiful messages in those cards to so many people. Much will be said, posted and published about the contributions that Trisha has made in her professional life, and yet she was so utterly devoid of any ego and was the most humble person I have ever met in my life. She was so willing to give her time, her knowledge, her expertise, and that really, I think, is part of the legacy that we should remember. Because imagine how different our world could be if we too could show some of that as well.
Trisha was appointed in 2007 as the inaugural chair in nursing between Barwon Health and Deakin University. I'll summarise just a handful of her achievements whilst at Barwon Health. Whilst diabetes was her passion, Over time, Trisha played a critical role in the development of a wide variety of clinical guidelines and numerous research projects. She was heavily involved in Research Week as Chair in Nursing and Director of Quality and Patient Safety. She mentored many and was a PhD supervisor right up until her passing. She also spent time in the Diabetes Referral Centre, keeping her skills current as well as sharing her knowledge with her colleagues. Among her publications, I'll mention just two. Caring of People with Diabetes, a clinical manual that rapidly became the gold standard for nurses and other health professionals, now up to its 5th edition. And the McKellar Guidelines. Trisha had just completed the latest revision. These guidelines are widely used in aged care. Her annual World Diabetes Day lectures were inspiring, thought-provoking, and you're always left with a take-home message. Trisha was a stickler for language. For example, there was no such thing as a good or bad diabetic. Her office was her sanctuary, yet it was a hive of activity. Always calm inside, hand-picked flowers from her garden, essential oils going, cuppa at the ready. She was in her office before the sun rose until after it set, with the heater going full bore irrespective of the temperature outside. Her fashion sense was her trademark, elegance personified. Vale, Trisha, you were the best nurse, a much-loved friend and colleague. Our thoughts go to John, whom Trisha always referred to as the wind beneath her wings, and her children, Althea, Tracy, and Justin, and their families.
Professor Trisha Dunning AM. What a great friend, what a learned friend, what a lady. I had the privilege of meeting Trish in the early 1990s when the two of us were presenting it in an oral presentation session at the ADEA meeting. We became firm friends after that. In particular, I'm going to just mention about her achievements on the international world stage. Trish really became an international star towards the end of the 90s when she became the first chair of the Diabetes Education Consultative Section for the International Diabetes Federation. And as lead of that group, she published the world's first diabetes education standards. And these standards were used all around the world for countries who were starting out in diabetes education. She continued to develop the international curriculum for diabetes education. And again, this was used worldwide. So Trish chaired that consultative section for 6 years, and then she became an International Diabetes Federation Vice President. And when she was Vice President, together with Dr. Alan Sinclair from the UK, she championed the global guidelines for caring for the elderly. Trish was also one of the first people to make us start thinking about complementary medicines in a more scientific way. I always loved Trisha's talks that she gave. They were very much more considered than many of the usual clinical talks that we all give and receive. She would always have poetry. She would have art. She would have cartoons. She certainly was a very learned person. And I know she spent a lot of time reading about these things. I've shared many a hotel room with Trish over the years as we did our international travels. And I know that she only used to sleep for 3 or 4 hours a night because she'd be up reading these very esoteric poetry and books and artworks. Amazing person. And so then Trish moved on and she started really looking at end-of-life care. And again, I heard her give a most beautiful talk when we were in Asia only a couple of years ago, and a real thinking, intelligent talk. So Trish Dunning, my dear friend, has achieved an enormous amount in her lifetime. She is highly respected by everybody that comes in contact with her. She's not only beautifully groomed on the outside, she's beautiful on the inside. She was always caring, always ready to listen, and a true friend. And Trish, I'll miss you.
I have known Trisha for more than 20 years. She was a supervisor on my PhD, and ever since we have worked very closely together in diabetes education and in diabetes research. I was delighted when Trisha Dunning took on the appointment at the Partnership of Bar and Health as a chair on nursing in 2004. And since then, Trisha has actually contributed immensely to grow nursing research, and particular obviously in diabetes. She was an integral part of the Centre for Patients and Quality research based in the School of Nursing at Deakin, and her voice, her soft-spoken voice, but very clear and very determined voice, will be sorely missed. She has, and I would like to highlight a sterling example of translational research. It's Trisha achieved in her area of particular interest in older people with diabetes. Her McGill guidelines for older people with diabetes in residential care has implemented along many agencies and care services across the country. She went to the Parliament and got support, and it's just a very good resource to show that the impact of her work is immense. It's very hard to achieve, but it's one of the many achievements Trisha has done. Trisha is a capable and passionate researcher, and she always put people in the centre. Her contribution to the diabetes education part of Deakin has always been very integral. Her book, Managing People with Diabetes, is a benchmark book, and I think she told me that it's been translated to 11 languages. So Trisha's impact on diabetes education and research is immense. She has a long string of students, PhDs, masters and honours. They all have benefited of her leadership and her research capabilities. And we all are very saddened about Trisha's passing. However, her legacy will always be there, her impact will always be there, and for that we're very grateful. Well, Trisha.
I met Trisha Dunning first in 1986 when she came to work in the Department of Endocrinology and Diabetes, headed at that time by Frank Alfred and Jim Best. And later on, I became Deputy Director of Endocrinology and Head of Diabetes Services, and worked with Trish to look after patients with diabetes in our unit. We collaborated on a number of projects over the years, and Trish wrote a book about the nursing management of diabetes patients, which became a classic in teaching nurses. She was kind enough to ask me to collaborate with her on a book managing the clinical care of diabetes patients, which we published and later had translated into Turkish, interestingly enough. I enjoyed working with Trish immensely, and she was a very innovative and intelligent worker. She was a prolific writer and had over about 300 peer-reviewed journal articles and several books about diabetes. She was given an Order of Australia for her work in diabetes and nursing in 2004. She left us in 2007 to go and work at Deakin. We missed her then, and we all miss her now that she has left us.
On behalf of the ADEA board and staff and the board of the ADEA Diabetes Research Foundation, I offer our condolences today to Trisha's family and friends. Trisha was a warm and generous person and an intellectual and highly respected pillar of our community. Trisha made an outstanding contribution to diabetes education in Australia and internationally through her research, her publications, and through supporting many people in their work, their studies, and their research. I first met Trisha in around 2010, and this memory is firmly etched in my mind: her gentle kindness and warmth, her sense of humour, her strong work ethic, and her keen intellect. Vale, Trisha, you will live on in our memories.